Good afternoon, ladies and gentlemen. Welcome to the second day of the UN Environment Assembly, and welcome to our regular press conference. And I'm delighted that we're focused today on a key annual report that UN Environment puts out, involving a range of remarkable experts that our science division convenes and collaborates with, and that really looks forward at some of the challenges and solutions that are emerging in the environmental space. If you think about that saying about known knowns, known unknowns, unknown knowns, the Frontiers report is one that really kind of pushes our thinking forward and challenges us to think about aspects of environmental development, environmental action that we may not have thought about. We have, in fact, a number of panelists today, including our high-level panel that will start us off. We will have to excuse a couple of our distinguished ministers who are with us for other obligations. So I won't take any more of your time, but to introduce this session, introduce the report, and start us off, let me welcome the Deputy Executive Director of the United Nations Environment Programme, Assistant Secretary General of the United Nations, Ibrahim Chow.
Thank you, Nathan. Good afternoon. I like that. When I say good afternoon, people respond. Thank you for coming, and indeed, thank you for coming to this event. It is not often that in the margin of an environmental assembly that you come and talk about science. And yet, without science, you can do nothing. The UN Environment Programme produces on a regular basis a report, actually an annual report, which we now call the Frontiers report. And this year's report has identified very important issues that will be introduced by our different speakers. I would like to welcome our two ministers that are on my left and on my right-hand side. I would like to also welcome my colleague Martin. I am very sorry that actually this panel is again a male panel, and I had promised to myself that whenever I find myself in an all-male panel that I will just withdraw. Now, as being main host to this event, I take responsibility first, and I will speak very little so as to give the floor to others. The 6 issues are the environmental dimension of antimicrobial resistance. You will hear more about it from our panelists, but there's a big bug coming to the world, and that big bug has a serious environmental dimension. The second is nanomaterials. We are becoming very smart, and we are nanosizing most of our products, and that also has a serious environmental consequence that we would like you to pay attention to. The very good news coming from the biodiversity world and those dealing with oceans is that actually governance of marine protected areas is now becoming a reality, and we are almost there in terms of reaching the targeted ambitions of gazetting more space from our oceans to become marine protected areas. The fourth issue is now becoming better known, but it is a big issue. I myself am coming from the Sahel and the Sahara, and sand and dust storms are affecting people's life very badly. We are here talking about pollution. Sand and dust storms are a serious air pollution issue. If you go to the Sahara, you see that most people have a turban. And that turban is not only to protect them against, from the sun, but it is also a filter. And you see in many countries in that range where people have serious respiratory diseases, including in my own country. Until recently, they could not understand why they have so many cases of tuberculosis. It is actually these small particles that are there. but also it reduces agricultural production. Off-grid solutions are very good news for many parts of the world. I will also leave the space to our speakers to talk about it. I will finish with the environmental displacement. You may have seen the horrible stories in Libya with the slave trade that is going on there. That is one of the consequences of environmental displacement. Young people are leaving their native Sahel or Eritrea or other parts of the world, essentially pushed out for lack of production and lack of hope. And they know that it is perilous to cross the Sahara. It is even more dangerous to cross the Mediterranean. And they know that 1 out of 3 may not survive, but they still go. They still go as young men, young women, and they go with their babies. And pregnant women are actually found in these camps. It is one of the severe consequences of environmental displacement. When we talk about it, people think more about small islands, but it is actually a global challenge to the world. I'll stop there just to say I apologize to the world that I find myself with 4 black suits with ties. Was it not that I'm the main host to this event, for which I take serious and responsibility, it will not happen. So you can tweet about it. Thank you.
Thank you very much, Mr. Chow. And I know that our second set of panelists who will hopefully join you, the gender balance will improve as well. But with our present panelists, the DED has introduced our esteemed ministers, but let me now turn to His Excellency Mr. Vidar Helgesen, Environment Minister of Norway, for his remarks with perhaps a particular focus on the environmental dimension of antimicrobial resistance.
Thank you very much. It feels fitting now also to apologize for being a male. But at least both Marcelo and I represent countries that have women as heads of government, so that's at least something. In Norway, we have a woman prime minister, a woman finance minister, and a woman foreign minister, so we're also pleased that men are represented in the government. I think this report is, and the fact that UN Environment is producing the Frontiers report annually is very important because it brings forward emerging issues that need the attention of us as politicians. But it is also important because it is connecting science and policy. And more than ever, we need to stand up for knowledge-based policies. We do see at this time that you can be politically successful by ignoring facts or twisting facts or choosing your own facts, and we really need to fight that tendency and stand up for facts. Just some weeks back we had in Oslo a very exciting meeting. It was not one of those media attention-grabbing meetings, but it was a meeting where Governor Jerry Brown from California and I met with world-leading academies of science to discuss, not least in the run-up to the climate conference in California next year, how we can do more to ensure that science is at the heart of politics, not least politics pertaining to climate and environment. We need solid science and hard facts to be at the forefront of policy making. And that's a very, very important dimension of this report. Last year, microplastics was a significant part of the report. I see this year nanomaterials are, but one of the issues which I will focus a little on and which Norway finds important is the findings here on the role of environmental factors in the development of and spread of antimicrobial resistance. Now this is an issue, antimicrobial resistance is an issue that has long been on the agenda as a health issue, as a food security issue, as a sustainable development issue, it is indeed one of the biggest threats to health, according to the WHO. But the research now showing that the environment side also has a role and needs to play a role and needs to improve the knowledge base is very important, because we need to ensure that antibiotics remain a common good for future generations. And when we see emerging evidence that tackling pollution is key to solving the antimicrobial resistance crisis, we need to invest more in getting more knowledge about that, and at the same time we need to take action. In that, it is also important that we work across sectors, and anyone who have been in government can attest to the fact that interagency processes can be demanding and time-consuming, and in that context as well, having facts on the table can be immensely helpful and important. Now, Norway has a strategy from 2015 on antimicrobial resistance, where the Health Ministry, my Ministry of Climate and Environment, the Ministry of Agriculture and Food, and the Ministry of Trade and Commerce have joined forces, basing ourselves on the One Health principle, that human health, animal health, and plant health are part and parcel of what needs to be a unified approach to fight antimicrobial resistance. And in the work to implement that strategy, new information, new knowledge is going to be important, and that's why we see the Frontiers report as really a very helpful tool in our day-to-day political work and administrative work to achieve better results for the environment. Thank you.
Thank you.
Thank you very much, Minister, and appreciating, let me say, the centrality of antimicrobial resistance. Our second panel will also be focused on that. But first, let me turn to another critical dimension coming up in this year's Frontiers report, which is the governance of marine areas. And here, from the other end of the world, so certainly regional diversity, we're very privileged to have His Excellency Marcelo Mena, Chilean Minister of Environment, with perhaps a focus of his remarks on marine protected areas. Minister.
Okay, thank you so much. Well, I'm a scientist myself, and I think it's really important to have the best science available for policies. Many times we don't have the opportunity we can't waste time in failed policies because we didn't include all the information on the table at once. Such as the issue of the short-lived climate pollutants, the black carbon issue. We supported diesel, we supported wood for many years. It came at a very negative impact to the air quality of the people. That's why I think it's important that Norway also has been supporting the Breathe Life initiative, which is very successful to showcase the importance of integrated climate and air pollution policies. But the fact is that we do need to have what's coming up on the table. Another issue I think we need more information on is plastics in the ocean. When we were doing our plastic bag ban, the amount of papers that you could look into weren't that many. There's one big one on, I think it was Nature. It was showing how much plastics was coming, but really the recipe to protect the oceans from plastics isn't really that clear. It's sort of intuitive. You sort of know that if you get some plastics out of the way, some way magically it won't end up in the ocean. But really, we need more science on that. And maybe the issue is that science is not something that could be looked at as peer-reviewed. Maybe it's just it's not elegant enough for peer-reviewed journals, to be counting trash in the beaches. But it's very important that we do have that information on the table. The benefits of marine protected areas is something that we also need, because right now we have the drive for President Bachelet to increase the marine protected area location. But we need to also convince the communities that conservation is a way to allow populations to recover. We need to have them know the benefits of marine conservation, whether it be a marine park or no-take park or other type of management practice. We need to show the benefits to the communities. It's great that new research has come up showing that marine protected areas are good as a way of climate adaptation, that healthier ecosystems are more resistant, more resilient to natural disasters. That's something that's very important. We need to have more information on the table of the greenhouse gas capture. Chile and other countries have been looking and supporting the IPCC to be looking into what oceans are in the terms of greenhouse balances and how carbon sequestration can change whether you have other impacts on marine protected areas such as ocean acidification. So I think we do need to have more of that information. But the main thing overall is that we have the Aichi goals, which is 10% conservation, and the Paris goals, right? We know that world fisheries are depleted, so we have a 10% goal of conservation. We know that climate change, we need to keep it under 2 degrees, and we have zero emission projection by the end of the century. So I think there's a gap between the ocean conservation efforts that we're doing versus the impacts that we're already seeing. So therefore, we need to increase the ambition of the marine protection. We need to have more evidence to show that this is something that's not just hindering your capacity to thrive and your communities to have economic development, but actually as a means to really guarantee a sustained growth for the future. So that's why we're in the middle of a process that's going from 4% of our economic exclusive zone to 46% of the economic exclusive zone, done mainly with large parks in the islands, but also in Cape Horn we're doing a big one, and also with indigenous consultation. So our recent one in Easter Island had a vote by the islanders, which the Rapa Nui people, who voted what kind of a marine protected area they wanted, what kind of limitations that occurred, and we had to, and that's something that we should do, recognize the results of the votes as the means of the design of our marine protected area. So we didn't do a marine park with no take. They wanted to limit this to traditional ways of fishing, and that's a way to go. So overall, this thing is just this conflict is short-term thinking versus long-term thinking. If you think in the short term, if you could make a lot of money and deplete your fisheries, but this will come at a cost of the future communities. So therefore, we do need this long-term thinking, and the evidence that the Frontiers report gives us are a good basis to continue expanding ambition on ocean conservation. Thank you.
Minister, thank you very much. Let me take cognizance of the fact that we're at 1:19, and I understand our ministers have commitments in the context of the Assembly and may need to leave at 1:20. So please allow me to excuse you and thank you very much for your time. But by all means, we will get back to you. But thank you so much for being with us. Let me turn now to my colleague Martin Capelle, who will give you a little bit more of an overview, technically, of the substance and the findings and key outcomes of the Frontiers report. You want to use the thing? In parallel, also, at this point, let me invite our next set of panelists up to the panel. We have 3 specialists with a particular focus on the antimicrobial resistance dimension of the report, and we'll welcome your questions to them after Martin's presentation. We have, of course, a number of other experts I'll introduce a little bit later in the room who can take questions on other dimensions of the Frontiers report. But at this point, let me introduce Dr. William Gaze from the University of Exeter Medical School of the UK, Dr. Maria Neira, Director of the Department of Public Health, Environmental and Social Determinants of Health from the World Health Organization, and Dr. Tabitha Kimani, the Regional Social Economist from the Emergency Center for Transboundary Animal Diseases at the Food and Agricultural Organization. Thank you very much for joining us, and let me turn to Martin for his presentation.
Thank you very much, Nathan, for passing the floor, and thank you all for being here with us. Over the next 5 minutes, I will provide a brief introduction to the 2017 edition of the Frontiers report, which is presenting, as our Executive Director, Deputy Executive Director mentioned, 6 emerging issues of environmental concern. And these 6 issues are among the many that have been identified by our network of scientists, experts and institutions across the world as having emerged with potentially significant impacts on society, economy and the environment. And now I will present in the next few slides each of these 6 issues. Next slide, please. The first one is on antimicrobial resistance. This report explains how the environment and pollution play a critical role in the emergence and spread of antimicrobial resistant bacteria. Our soil and water are contaminated with antibiotics and chemicals originated from households, agriculture and industries. These chemicals promote antimicrobial resistance in the environment, and people are exposed to those resistant bacteria through food, drinking water and direct contact with the environment. Now, tackling pollution is key to solving this antimicrobial resistance crisis. The next topic, next slide, yes, is about nanomaterials. These are now present in consumer items such as cosmetics, food products, clothing, and household appliances. Nanomaterials have amazing properties and offer countless applications. With promise come risk and uncertainty. Human exposure to nanomaterials through environmental pathways is inevitable. We need to be prepared to manage exposure, assure safety, in order to enjoy the many benefits of these new materials. The third topic is about marine protected areas, as our minister from Chile just discussed. In recent years, we have seen marvelous efforts by many countries, including Chile, but also Indonesia and many others, in designating coastal and marine areas under protection. Now it is a race to actually meet the 2020 Aichi biodiversity targets, as well as the Sustainable Development Goal on life below water, the goal number 14. Fortunately, to date, over 15,000 marine protected areas have been designated, equivalent to around 6% coverage of the global marine waters. The 2017 Frontiers report stresses the importance of combined governance approaches needed to make marine protected areas truly effective in order to deliver social, economic and environmental benefits for all. The next topic, number 4, is about scent and dust storms. Scent and dust storms cause devastation across the world, threatening the lives and livelihoods of millions of people. This report explains how desertification, land use change, excessive water extraction, and unsustainable agricultural practices contribute to at least 25% of global dust emissions. Now, under the influence of climate change, dry regions are projected to become even more dry and are likely to face more dust storms. This Frontiers report in 2017 highlights various initiatives that restore drylands and have helped to reduce the frequency and the severity of dust storms locally. Topic number 5 is about solar solutions, another emerging issue. The world is becoming more urban, we all know. By 2050, around 63% of developing countries' populations will actually reside in cities. Access to affordable energy is not only key to people in rural areas, but also to urban residents, especially in informal settlements. Recent years have seen an increased popularity of small distributed solar systems among low-income communities who live off power grids. Here we highlight the opportunities offered by simple solutions for off-grid communities to continue and remain on the sustainability pathway. The next topic, number 6, is around environmental displacement. Environmental change and degradation are fundamentally redrawing the map of our world today. They affect where and how people can ultimately thrive. In the last 5 years, nearly 120 million people have been displaced by weather-related disasters, almost 3 times more than the number of people displaced by conflicts. The complex interactions of climate change, population growth, and environmental degradation are likely to lead to greater numbers of displaced people in the future. This report stresses that unless we deal with long-term environmental vulnerability, and build resilience in communities, environmental displacement will become the new normal. Next slide. I hope that with this brief introduction to the report, you now get a kind of flavor of the emerging challenges that we are facing and that require our concerted actions. Thank you very much for your attention, and pass the floor to our moderator. Thank you.
Martin, thank you. Thank you very much for that very comprehensive overview of the 6 key issues that the Frontiers report has addressed. Again, there is clearly a particular attention and urgency perhaps to the environmental dimension of antimicrobial resistance, which is the justification for a very distinguished panel here who have been involved with the report and certainly involved with the issues. In the interest of time, we would like to keep this session interactive and really open the floor to questions with the panel. And as I say, we have some of the key people involved with the other issues as well, so not to just limit you to antimicrobial resistance with us as well. So let me open it at this point for questions. And if we don't have questions, I have one maybe to the panel just to sort of substantiate. I'm, curious clearly and extremely ignorant. Antimicrobial resistance has obviously been an issue that's been kicking around for a while. This particular focus on the environmental dimension and the selection of this year's report to highlight it as a frontier issue, if you will. Why the urgency? Why does this matter, and what's the gap in action?
Well, I think the answer to that is because the number of antibiotics that we have now are running out. The effective ones are running out. So there's no surprise really that this is an environmental issue, because antibiotics, which are the antimicrobials we use to treat bacterial infections, are in many cases of environmental origin. So they're produced by microorganisms in soil and water and have been produced by them for probably billions of years. So it's not surprising there are resistance mechanisms in environmental bacteria that have found their way from those environmental bacteria to clinical pathogens. And this is something really that's not been acknowledged, I think, by many people in the medical community, because of course you treat someone with a resistant infection, you don't really care about why they're resistant at that point in time. And of course there's a perception that resistance is to do with mutation under chemotherapy, but actually now we know that many of the resistance mechanisms that are circulating in human pathogens globally have come from environmental bacteria. And the real concern is that pollution, which from wastewater and human pollution and from animal pollution, where most antibiotics that are produced globally are used in livestock production, that all of those antibiotic residues that are excreted by animals and humans go into the environment with all of the resistant bacteria that we excrete every day, humans and animals, and they mix with this ancient sort of reservoir of resistance. And this is what may be why, or this is likely to be why, novel resistance mechanisms keep emerging, and we can't keep up with, we can't keep up with this emerging resistance with new antimicrobials. So I've tried to encapsulate really why that's an issue.
Can I say? Yeah, thank you very much. And first of all, congratulations on this beautiful, not only presentation and I think it's very friendly to read with a lot of pictures. It makes it really very interesting. And in addition to that, congratulations as well on the selection of the 6 emerging topics. I think this gives us an idea why we need to care about, and clearly antimicrobial resistance is one of them. As you probably know, for WHO, this is, we are saying that we are probably entering on what we call the post-antibiotic era, which is something very, very, I'm very much afraid of that. I mean, I'm a physician by training, and for us, antibiotics were one of the best, the most powerful tools. You think that if you have the right antibiotic, you can solve any problem. Today, that tool is kind of leaking in our hands, and this is of major concern for the global public health community. The reasons for that, well, obviously we are using and probably overusing and abusing of antibiotics, or not a very strategic way. And the second reason as well is because we are using it very, very much to growth, for meat production and growth animals. And that's complicating in the European Union. That is now forbidden, but there are still under use in many countries. In addition to that, we need to look at what is the role that the environment is playing into this potential antimicrobial resistant mechanism. And we need to know more about what you were saying, that maybe, what is the role that the environmental plays in all of that. What is sure is that we need to do something about the release of all of those antibiotics, antimicrobials into the environment. The sewage and the water treatment shouldn't be receiving all of those residues of antibiotics and antimicrobials. Whatever we do to improve the sewage system, to improve the environmental conditions, no matter what, we'll have even if we don't have the answers yet for some of the mechanism of how the environment can contribute to that, it will provide enormous benefits for the health of the people. So in that one, we are very happy to join forces and making sure that we have hopefully very soon the answers that we are looking for, and how the environmental community and the health community can join our networks and communities to do more on tackling this critical public health issue, which is the antimicrobial resistance. I hope that this prediction by a very eminent scientist that in 2050 there will be more deaths because of lacking of the right antibiotic than any other disease. I hope this will be a wrong prediction, and if we take the right measures now, hopefully it will be the case. Thank you.
In addition to what they have said, what we are observing in the livestock sector is that due to antimicrobial resistance, particularly on the pathogenic organisms, a lot of animals are dying, and due to unnecessary deaths, and they could be avoided if we tackle AMR, and this is seriously affecting food security. And working with countries in the region, and I think that is why this report is very critical at this moment, is that the countries have gone into development of risk mitigation policies and working across sectors as One Health, using a One Health approach. And what I've observed is that the environmental dimensions have not been very clear, and that's why I think this report actually sheds the light, and now the countries have information on how to engage on what are the environmental dimensions of AMR. And the environmental ministries have actually been grossly missing from the scene, particularly because they didn't quite understand what is their role in AMR. And this report, I do imagine, is going to help the environmental ministries to engage with the agriculture and public health sector to develop better risk mitigation policies. Thank you.
Thank you. Thank you. Any questions? I have a, please.
Coming from it's always coming from the context where someone's entered into the health system, the institutional system. And, you know, I find myself now more and more encountering, on a traditional medicine side, plants and animals, plants particularly, sorry, that have got many, many properties which potentially could be put into the mix. And yet the pharmaceutical companies are not really very interested in developing some of these. And I just wonder whether you see a future where more biopharma, in other words, not just the stuff that gets developed in laboratories, but much more use of natural products, might actually play a role now, in the sense of we're looking for new horizons, and can we actually be a bit more open in how we, you know, canvass the natural world to respond to such a global challenge? Thank you.
There are new attempts, or current attempts, to sort of kickstart this sort of natural product discovery pipeline. But I think antibiotics are very difficult because, you know, you spend your $1 billion or whatever it is developing the drug, and with the prospect that resistance might arise quite quickly afterwards. So when the payback for drugs is sort of within the sort of 15 to 20 year period post-patent, I think it is, that, you know, it doesn't really seem economically attractive. And I know that's why there's been some sort of public-private sort of initiatives into sort of new drug discovery models, which are being looked into, and I think that really is necessary in this case. Also, some people have pointed out that whilst people might, you know, pay tens of thousands of dollars for a anti-cancer drug which might extend their life by a few months, people won't spend a few dollars or hundreds of dollars on an antimicrobial that will save their lives. So we've started, I think we've taken antibiotics for granted. You know, they really underpin all of modern medicine. You know, this post-antibiotic era, you know, when we're going back to what it was like in, you know, pre-antibiotics, when, you know, you would die from common infections, you know, all of the sort of surgery like hip replacements, all the cancer treatment that in certain parts of the world, you know, that relies on prophylaxis with antibiotics, childbirth, whatever, will become much more dangerous. You know, but people forget that because we've just used to having a pill that cost a few pence or a few cents, you know, and that solves everything. But we're not in that situation anymore. Microbiologists are looking for new methods to look at this untapped natural product diversity that there is in the environment, and people are trying to use culture methods that mimic more perfectly the sort of the environments where those bacteria live. They're growing bacteria together in groups because there's synergy between bacteria. They live in communities, not on their own, so that might actually reveal new secondary metabolites and new natural products. So I think there are efforts, but a lot of it appears to be the economic drivers there are for this particular type of compound.
Yeah, totally in agreement, if I may, moderator. Totally in agreement. I think maybe I'm forcing a little bit the discussion here, but why not to link what you rightly say to one of the SDGs, which is about sustainable consumption and production. This discussion is a discussion that has to go beyond the medical and the clinical community. This is something that has to put us in front of the way we are consuming our fantastic tools and using antimicrobials on a very irrational way sometimes. Most of the infections are occurring because people doesn't wash their hands. Believe it or not, this is still one of the issues why we get infections at the hospital level or the healthcare facility. So there is no way to solve the problem of antimicrobial resistance without a confrontation to all of these patterns of development that we are having now, where maybe traditional medicine will play such a role that will not be certain treatment will not be needed because we were avoiding it at the beginning by having safe water. That will avoid us as well a lot of infections. But this is a societal debate where the investment has to be done according to a strategic discussion and not according necessarily just to the economic interest of the production of certain antibiotics and the returns that they need to provide to our society. So I hope we are raising enough awareness with events like that on saying that this is very serious. And this is not just for the pharmaceutical companies keeping looking and searching and developing new antibiotics, because there is no such a new antibiotic that is coming. So we need to deal on a more strategic way with the situation, looking at the role of the environment, looking at the role of the traditional medicine, looking at the role of a more biodiversity, because otherwise we will as well finish with some of the products we are using now, a rational use of antibiotics, a rational agricultural and livestock production, and then hopefully a better research and a stimulus for that. Thank you.
You make a compelling case for conservation as well. In terms of, and you alluded to it, Dr. Gaze, in terms of a political message to ministers of environment at an assembly considering pollution really as sort of its overall frame, what's the sort of the key message here? Tangibly, what do we need the world to sort of resolve to do more of, to escalate?
I'm going to frame that by referring back to your hand washing statement that, you know, still in the hospital, one of the main ways we tackle transmission of resistance is through hand washing. So we obsess so much about that, and yet then we take the waste, the fecal waste of, you know, whole cities, and we basically dump them into the environment, and that environment we use for our drinking water, we use to grow our food, we live in the environment, you know, we swim in the rivers or the sea. So it's never made sense to me that we focus so much on infection control in the hospital, which in essence is totally reactive. That's after the bugs have got into into humans, and yet we pay so little attention to what's going on in the wider world. So you can think of the environment as an extended fecal oral transmission route. Well, it is. I mean, we know it is. So why say you must wash your hands and use these alcohol gels, whatever, and yet we're quite happy to, you know, if you start thinking of the numbers of resistant bacteria that are discharged into the environment every day, it is unimaginable. I mean, you can have millions or tens of millions of bacteria in 1 litre of wastewater. You know, there are 1 billion bacteria in a gram of sediment or a gram of soil with 5,000 species. So these numbers are just astronomical, and that's part of what makes this problem quite intangible, I think, for the public, is that the numbers, you know, the scale of evolution over which resistance has occurred is billions of years. The numbers of bacteria on Earth are 10 to the 30, which there's a statistic which is if every bacterium was a penny and you stack them up, they would reach for 1 trillion light years. I mean, resistance, multi-resistance can happen just like in a split second when a bacterium acquires a mobile piece of DNA that has resistance mechanisms to multiple antibiotics on, and then you add in the chemicals, where, you know, we're discharging antibiotic residues. 70% of the antibiotics we ingest, we excrete back into the environment. There are antibacterial cleaning products, biocides, disinfectants, there are heavy metals, all of which are having this potential driving of resistance. So it's a hugely complex sort of, you know, system, but we've chosen only to look in the clinic. And of course, clinical use of antibiotics is probably the main driver of antibiotic resistance. There's no doubt about that. Antibiotic usage in animals is also a major issue, and also in the environment. We're yet to really understand the relative contribution of each of these components. But I think really what this chapter is trying to do is to raise this as an issue on people's awareness that it's not just a clinical issue, and we can't sit back and just let the doctors sort it out.
For the agriculture sector, I think what is critical is particularly the waste that is coming from the agricultural systems. Livestock manure is one of the mechanisms through which antibiotics residues or antibiotics reagents are shed into the environment. So and this is key to the strategies that are being put in place, is how to manage this manure from the livestock system. We foresee that in the future, even in this part of the world, we are going to see more of the livestock systems intensifying. So the key is to manage the waste that is coming from these systems. And we have already been able to prioritize the systems, and this is mostly the poultry systems, the pig systems, and this is where most of the waste is actually contaminating the environment. So that is one area that is being looked into. But also we are also focusing into if you use less antibiotics in the animals, they shed less. So you have to use different approaches to make sure prudent use, they use less, but also manage whatever they release into the environment is better managed.
I go back to your question and saying why ministers of environment should care about this. And I think the answer is very simple. It's your business. I mean, it's your business as well. It's the business of the clinical community. It's the business of the public health community at large. It's the business of the ministers of environment. It's the business of the people working on water, sanitation, energy, and all of that. When I use the sample of washing hands, for me, it's not just using a disinfectant. Actually, I was not even thinking on using a disinfectant because that's very sophisticated. I was thinking that the healthcare facilities in Africa where you cannot wash your hands because you don't have water. not because you don't have disinfectant, because you don't have water. So for me, the real prevention medicine, the primary prevention starts on access to safe water, sanitation, environmental measures that will be prevent all of that. Obviously agricultural practices, and in this case animal health, which is very much related to what we are discussing here. So Ministers of Environment, this is your business as well. It will be very inappropriate to keep it in the hands of the clinicians, not because the clinicians, we are bad people. I'm not anymore a clinician, but I'm a real public health, but because it will be unfair as well. If we are losing antibiotics, is a problem, a holistic problem, where we are all contributing our little piece. I'm not contributing because I never take antibiotics or I have to be really very sick. But all of us, we are eating maybe some products that have been treated inappropriately with antibiotics. So it's all a discussion that needs to be in place, and starting with environment provide us a very large opportunity for discussion. No matter what, how much we will be advanced on the research, I don't think we need to stop the involvement of the environment, because, as you rightly say, we don't know the role that it plays on the antimicrobial resistance mechanism, but we know that it's not right to discharge all of those fecal and antimicrobials and chemicals into the water that then will end up in getting back to us again. So it's your business, it's our business, but it's each of us as well as individual, we have our little responsibility to contribute as well.
Ollie, please.
Thank you. This is
a little bit in terms of the way that that this is getting expressed is, I think perhaps it's a sort of human response to always focus on the reactive things, like you're saying, that the tendency is to focus on hand washing or what drugs you can take, or if those drugs start running out, the drug pipeline for future. And part of the challenge in making the environmental argument around this is showing what better environmental management can deliver in terms of reduced resistance, because you're trying to prove a counterfactual. You're trying to prove what would have happened in the absence of a particular action. Are there any examples you can point to of where better environmental management in general has had an impact on perhaps livestock resistance or human health antimicrobial resistance?
So there are some examples where antibiotic usage reductions in animal production correlates, or there's an association with reduction of antibiotic resistance in the clinic. But there's not a huge amount of evidence, not because there's not a link, but because not a lot of that research has been done, or if it has been done, it's been done in quite small scale studies, not really big sort of trial type approaches. So we do know, if you look even within a single river catchment, that you can see orders of magnitude difference. So you can see 1,000 times higher levels of resistant bacteria in river sediments downstream of wastewater treatment plants, or adjacent to certain types of land use where there are grazing animals. So even within a single river system, you can see that there's quite a fluctuation in the levels of resistance. Of course, we don't know the role of those resistant bacteria in that environment in human infection, but we do know, so for example, in my laboratory we've been doing some work looking in recreational bathing waters in the UK, and we've estimated that there are millions of exposure events per year at a populational level in England and Wales, for example, and we know that very highly exposed water users have higher gut carriage than control groups, for example. So we're beginning to piece this together, to this evidence chain. I mean, it's very logical and intuitive that wherever you use large amounts of antibiotics, or wherever large amounts of antibiotics are, which includes the environment, even if they're at very low concentration, they affect a huge area of land spatially, that you're going to get this exertion of a selective force for resistance. You know, you're going to drive resistance up. We know that we are intimately involved in or connected to our environment through our food, through the air we breathe, through the water we drink, and just with our general day-to-day business, even people that live within cities. So there is the evidence needs to be gathered, more evidence needs to be gathered, but I think in the chapter it's discussed about what evidence is necessary with these very, very complex environmental problems. You know, I think I was saying to someone before, you know, I can hold more bacteria in my hand just in a little sort of like a few grams of soil in the palm of my hand. There's more bacteria in there than there are people on the planet. There are 5,000 species of bacteria in a gram of soil, or, you know, so this complexity is staggering. And actually looking at cause and effect relationships through these very complex ecosystems, which is effectively what they are, is very difficult. So at some point we need to look at the available evidence and say we have enough evidence to start bringing some of these really logical mitigation strategies, because actually even if it doesn't help with reducing resistance, we know that improved sanitation improves lives in so many other ways. And so there are lots of examples of things that we should be doing. You know, the environment is not just one huge toilet, is it? It's not one, you know, it's not a dumping ground, but we tend to use it as that. Bacteria and chemicals are invisible. We don't see them. It's not like marine plastics, which are so horrifying when you see these plastics. Actually, those plastics are probably relatively harmless, arguably, compared to some of the, you know, chemical and pathogen, you know, risks that we face. But they appeal to us as humans because they're very visual. You know, bacteria, microorganisms, and chemicals are not visual, but doesn't mean they're not there. It doesn't mean they're not a problem.
On your question, if you have a strategic management of the environment, or a wise management of the environment, the benefits for human health will be enormous. We might try to go as far as measure how much this will impact on the antimicrobial resistance, but no matter what, as you rightly said, this will be generating good results for the environment, for the human health. So while we go ahead with providing evidence and conducting more research, we can propose and put in place already all of those interventions because there are common sense. I mean, there are good sense. You need to do it no matter what. As you say, this is not a toilet, so we cannot keep putting all the chemicals and antimicrobials in the environment. Now, concretely on the issue of the big challenge of antimicrobial resistance, the environment will play a role, but it's a holistic approach. And still we need to look at the infection control at the hospital level. Obviously, we need to do a lot on ensuring access to safe water and sanitation for everyone. We still have almost 1 billion people around the world practicing open defecation. This is contributing to antimicrobial resistance, but it's contributing as well to increasing the number of diarrheal diseases. I mean, all is interconnected. So if we want to address antimicrobial resistance, we need to reduce the use of antibiotics as well, of course. We need to provoke a better discussion with our colleagues at the animal health and then reduce the use of antibiotics in animals. And we need as well to look at the medical use and therefore the research and then the environment. So, but all of those pieces are part of this puzzle, and each of them are critically important.
Thank you, Nisha. Thank you, panelists. I know we are getting close to the end of this session, but I think that there's one important question for us, for you in environment. As you know, and this is a question for the panelists, as you know, UNEA is mostly a normative organization. So we offer the secretaries, we host the secretariats of the Basel, Rotterdam and Stockholm conventions, and also for the SciChem Secretariat, which is the strategic approach to international chemicals management. So my question to you would be, what role do you see for you in environment going forward to take this issue of antimicrobial on the agenda, perhaps within the framework of the strategic approach for international chemicals management, which has its ICCM meeting in 2020, right, the International Conference on Chemicals Management. Do you see a specific role for the organization? And I think a colleague here would like to add. Is that correct?
Deal with antimicrobial resistance. So I guess that your question is partially answered. Ministers of Environment have already looked at this issue, and the decision will be adopted probably tomorrow as it is, and that's our hope. Under the strategic approach for international chemicals management, we already have antimicrobials, maybe not in the full name, but we have it under environmentally persistent pharmaceutical pollutants, because antimicrobials are pharmaceuticals, are pollutants, and are of environmental risk. So in reality, the role of UN Environment as policy, it has already started. We need to go beyond, and there is where holistic approach and multi-stakeholder gathering is important to really tackle the issue. And by 2030 SDGs, or by 2050, as Dr. Neira was saying, we don't have to regret that today in 2017 we could have done a difference.
Thank you. We have about maybe 2 more minutes, so in case there's any further response to Martin's question.
Yeah, ultimately, I think that people are discussing now whether antibiotic-resistant bacteria should be considered as a pollutant themselves. So whether there should be discharge limits on the type or the numbers that should be discharged in certain waste streams, for example. The European Union are looking at 3 antibiotics in their hazardous compounds watch list. So at the moment, of course, the endpoints for the effect of those antibiotics is some sort of ecotoxicological assay, which might be using a Daphnia or something like that. So that's a toxicity, whereas antibiotics, it's not their toxicity we're worried about, it's their ability to drive resistance. So there's data coming through now which will actually inform risk assessment of actual concentrations of antibiotics that we find in the environment. So, for example, if we find 1 microgram per litre of a particular antibiotic in wastewater, for example, is that a risk in terms of driving evolution of resistance or not? So these things can be regulated, these issues, I think. So ultimately, that's where I think we should be looking.
Thank you very much. Esteemed panelists, really thank you very much for being with us this afternoon and for your insights. And I learned quite a bit, but most importantly, I learned that I'm not going to go into a public swimming pool again until there's more science. But we're delighted to share the Frontiers report with you. It's available digitally on our website as well. This is a paper-free Environment Assembly, but I see some illegal printed copies, so those will be distributed as well. As we close, let me also acknowledge and recognize a few of our other experts who have worked on some of the other chapters and themes of the Frontiers report who are here and certainly will be available to anybody who might have questions about any of those other chapters as well. Dr. Suseno Sukonyo, Minister's Advisor from the Ministry of Marine Affairs and Fisheries in Indonesia. Jackie Alvarez, who just intervened with UN Environment working on antimicrobial resistance again. Ole Vestergaard, who's been working on the Marine Protected Areas chapter. Valentin Vocescu with UN Environment, who's been working on sand and dust storms. Ollie, oh, you were crossed off my list, but Ollie is certainly here as well, working on environmental displacement. And I see Sean Kahn in the very back of the room, who has worked on the small solar systems chapter. And of course, Jackie McGlade, of course. Nanotechnology. So Professor McGlade, formerly of UN Environment and now with the University of the Masai Mara. So these colleagues are all very much available to anybody who might have further questions on any of these chapters, and we can certainly connect you. Again, thank you very much, dear panelists. For the journalists in the room, I've been asked to let you know that at 2:15 in the media tent upstairs, there will be an interactive session with our young champions of the earth, who we will be celebrating tonight, and our new Goodwill Ambassador Ellie Golding and our Executive Director Eric Solheim. So that session begins at 2:15 in the media tent. Thank you all very, very much. Thank you.
Say anything. Just be serious.
Okay.
Because I think I have to be closer because it's so you have to, like whatever.
Say some. I do.
That's perfect. And now when you look into the room and you move with your hands. Oh, that's perfect. Oh, that is terrific. You said that loud.